Hi, welcome to 5 Minute Video Study for the NCE. We are in clinical focus today, and we are in subheading B, physical issues related to anxiety. So, anxiety, first of all, just in general terms, is when we're talking about worry, we're talking about the notion of um, excess anxiety, excess worry, and it occurs for at least 6 months. So it can't just be, I'm worried for a test, but then once I take the test, then the anxiety subsidizes. This is something that has been occurring for at least half of a year. And I think the other thing that's important to discuss with worry, with anxiety, is that the person finds it difficult to control the worry. So, in general, I would say most people worry, but the criteria for the DSM 5 is when people find an excess of it. And then when we talk about some of the behaviors, like the physical symptoms, the DSM mentions, fatigue, restlessness, difficulty concentrating, irritability, muscle tension, and then sleep disturbances. So those are some of the criteria for the anxiety, general anxiety disorder. But for this subheading, it talks about some of the physical characteristics. So when we talk about physical characteristics, because this is a anxiety or generalized anxiety, it's a mental health condition, but then the mental health in turn causes some of the physical symptoms. So, one big physical symptom that is associated with anxiety is digestive disorders. Again, because there's an excess of worry, um, person might have trouble digesting. They might have diarrhea, or they might have bloating, or they might have just discomfort in their digestive system, and that in turn can then lead to whether it's under eating or overeating. So then you're having weight fluctuations associated with the worry. So the physical symptoms would then be manifested with the mental health symptoms. The other physical symptoms to be aware of is heart disease. Again, when now with technology, we have smart watches, and we have all sorts of gadgets where we can check our heart rate, and we can kind of check the patterns that the heart pumps. They call it the beats per minute, and we can kind of see how those fluctuates. And with anxiety, you do have changes in fluctuations, which would impact how much the heart is has to pump blood. The other thing associated with anxiety is the issue of chronic pain. And again, this could be the chicken or the egg scenario, right? Because if a person, let's say, gets in a job related accident, and maybe they have a fall, or if they're driving and they get in a car wreck, then they could have chronic pain issues. And a lot of times, if they've already been dealing with anxiety, then that can just increase it exponentially, because now they might be fearful of, getting in another car wreck. They might be fearful of climbing a ladder. They might be fearful of taking the stairs. So situations like that could manifest themselves, or could make it, exponentially worse, um, with anxiety and some of those physical symptoms.